Hello, my name is Ramone, and I'm an RN currently working at Osceola Regional. I've been a registered nurse for 2 years now, and ever since then, I've been working at Osceola Regional's PCU, which is a neurotrauma as well as a multi-system step down. At this unit, our unit manager makes us complete a nursing portfolio that we can use whenever we're ready to move on to a different position in another unit or another hospital. It shows our credentials, our skills, and everything that we've accomplished on the unit thus far. As I open it up, there are many different sections within this portfolio that include our nursing license, our certifications, our CEUs, our performance evaluation, our unit-specific training, and also our resume. So within the first section, you can see that I have my nursing license ready to hand for whenever I go to another interview or for a job in general. In section 2, you'll see my ACLS and BCLS card also. Skipping through a couple of other sections, you will see that I have my little certifications, such as my ischemic stroke CEU. I have my I have my hemorrhagic stroke CEUs. I have my thrombolytic therapy CEUs, and also my dysphagia screening CEUs. At my unit, we deal with a lot of neuro patients, stroke, seizures, and whatnot. In this packet, I also have my heparin education. Skipping further along, we have our unit-specific education, such as my trauma certifications. So in this, we have our trauma pediatric certification, my trauma neck injury certification, and also my geriatric trauma certification, which is our largest population. I don't really deal with pediatrics, but I mostly deal with geriatric populations, such as hip fractures, while I also do deal with younger populations, such as motorcycle accidents, and car accidents, falls, especially in construction workers type of thing. As we skip to the back, I have my resume. On the front of it, I have my cover letter, which shows my intent of why I'm looking for this new position. As you go along, you can see that it displays that I've been working at Osceola Regional for the past 2 years, and it's some things that I can do. It talks about my ability to assess patients, rapid response, my stroke, my trauma certifications, my ability to run certain drips like cardism drips, amiodarone drips, heparin drips. It lists out my education. I've had a 4-year-long nursing career. For the first 2 years, after attending TICO, I was an LPN for 2 years, and then after attending Valencia, I was RN for 2 years. During these past 2 years, as you obviously know, I've been at Polk State College, and it's also listed on this resume that I'll graduate December. It has my contacts, my references. On my resume, personally, I prefer to put higher up levels. So my resume, you'll see my unit manager and nurse practitioners or PAs that work along with me, rather than friends who may be more kinder in their judgments. In the very last part of my section, I know new employers, they love this kind of stuff. I have a couple of basically some compliment cards and emails from patients and family members stating that how much of a pleasure that I am for them to have. These basically in my unit we have something called Spotlight Excellence, and basically every week or every month we get raffles, and basically we observe the best compliment cards for each shift, and then they win a prize or a gift card. The gift isn't as much, but it's definitely a little gratification to know that your hard work is noticed amongst your peers and the patient's family members. So a little thing next basically it was my PDSA project. So my PDSA project, as you basically it was in my unit we were having issues with, you can say, report and missed nursing care. My unit has my hospital has a graduate nurse program where there are a lot of newer nurses, and when those newer nurses are overwhelmed, especially in a PCU unit with neuro and trauma patients, we sometimes miss nursing care, which might decrease patient outcomes. So I made a checklist for us to go over between shift exchange amongst all employees of the hospital that are knowledgeable in healthcare, um, basically to increase patient outcomes. It's called the trauma checklist. Trauma checklist. So basically, this trauma checklist has some certain things like strict I's and O's. Sometimes I guess nurses or CNAs may forget to document them, but this is very important so we can measure and monitor things like hemorrhaging or acute kidney injury or chronic kidney injury. Neurochecks. So in my unit, we have a lot of car accidents, motorcycles, trauma. So basically, this will help monitor traumatic brain injury or things such as compression syndrome or just decrease as an exacerbation in these patients' conditions. We have our vital signs Q4 hours, which is hardly ever missed, but I decided to put this on this checklist just to make sure that everything is progressing seamlessly. Incentives from our unit and our medical director of trauma, she's very adamant on certain things, like our using of incentive spirometer, because basically the number one reason for pneumonia or post-op complications is because of atelectasis. So an incentive spirometer helps prevent the atelectasis. SCDs to help prevent blood clot because our trauma patients are hypercoagulable. If not SCDs, we use other thromboembolic prevention precautions such as heparin or Lovenox. Our daily weights to monitor our patients for CHF to see if they're retaining. Within our trauma units, especially all patients, when they're brought in an emergency, rather than just checking this up in, they may receive IVs outside in the ambulance. They don't use clean techniques in these emergency situations, so it's part of our checklist to go ahead and basically switch these out within the first 24 hours to prevent and risk of infection. It's also important that we reconcile all home medications. Sometimes the admission nurse may forget this, which may decrease patient outcomes by preventing them from getting the necessary medications that they've been getting for a while. Sometimes patients can miss their blood pressure medications, which may throw their blood pressure unstable, and it may be harder to get it back under control. Also, completion of CTs. This is mostly done in the emergency department, and it's hardly ever missed by the time patients get on the floor. But it's also important for them to go over this so that basically nothing is missed, to touch every basis while we have patients in our care, because we're all accountable and it's part of all of our responsibility. So discussing being a BSN. This past 2 years has helped me progress my nursing standards and my nursing care. As a male nurse or basically person looking more into acute care or graduate school such as nurse practitioner or CRNA, I've had more of a theory approach to my nursing care, such as medical management, rapid response, medicine in general. Whereas learning in this BSN program that nursing is separate from medicine. Nursing is something entirely different, and nursing is an art form. It's not just giving medications. It's definitely an art where the nurse has uses holistic care to have a relationship with the patient and the community. The 13 canons really helped me out with that. Such things as warmth, ventilation, light, power of houses, cleanliness, eyes and nose, food intake. All that stuff is very important and can help increase patient outcomes in the long run. Because medicine is separate from nursing, and nursing can help a long way because there's certain things that medication can't do, which also comes into play with certain things like creative health, which Advent Health uses. Medicine is not holistic, while nursing is. Thank you.